uh, thing that smoking cessation should be tried and should be advised to the patient. He should be motivated to quit the smoking. We can use the chewing gum, the nicotine replacement therapies should be tried. We should recommend the physical activities and certain exercises should be tried in group 1 patient. Then a patient who can afford should go for a flu vaccination, a pneumococcal vaccination, pertussis vaccination, COVID-19 vaccination, and the shingles vaccination that is against the chicken pox. B and E. Smoking cessation should be tried. We should also try a pulmonary rehabilitation. The physical activity should be tried, and the flu vaccination, the pneumococcal vaccination, the pertussis COVID vaccination, and the shingles vaccination should be tried. Because vaccination, this gold guidelines 2023 says there is a very important role of vaccination. Now the key point in the non-pharmacological treatment of COPD. First of all, whenever the patient you diagnose, tell him that you are suffering from COPD. The patient should know about the illness of the कि आई एम सफरिंग फ्रॉम सीओपीडी और ये कैसे होता है, क्यों होता है और इसका मैनेजमेंट कैसे करना होता है, rehabilitation कैसे करना होता है. He should know. You should always advise the vaccination of the patient above more than 65 years of age. Annual influenza vaccination should be advised. We have tried the COVID vaccination, pneumococcal vaccination 20, or the 1 dose of pneumococcal vaccine 15. We can try diphtheria and the pertussis vaccination if the patient is not vaccinated in the childhood. A zoster vaccine to protect against the shingles in the patient above more than 50 years of age. Now the patient will come to you. Just a moment. That what should I eat and क्या मैं घी खा सकता हूँ, क्या मैं दूध पी सकता हूँ. Tell him to eat a good nutritional diet, good of antioxidants and the fruits and the milk to drink, because milk will have a very important role in the clearance of the sputum. The patient should be advised to have a less of the carbohydrates and the more of the fat and a moderate amount of proteins. The end of life and the palliative care should be aware about the symptom control. For the hypoxemia part, we should give the long-term oxygen therapy. If the saturation of oxygenation is less than 88% or the PO2 is less than 55. If the patient is not in corpuscle, he is properly oxygenated, then there is no need of the long-term oxygenation. About the hypercapnia, the patient should be hospitalized and a trial of non-invasive ventilation can be given with the help of a BiPAP, should be tried in the ICU. The interventional bronchoscopy and surgery in severe and very severe COPD patient with advanced emphysema or a large bulla, or lung volume reduction surgery, or the bulectomy, or the bronchoscopic interventions, or even lung transplantation may be considered. Now the implication of comorbidities in the management of COPD. COPD often coexists with other diseases and have a significant impact on the disease course and the treatment. COPD patients are at risk for cardiovascular disease, osteoporosis, respiratory infection. The patient, because of the long-term disease, will go into the anxiety, depression, diabetes, lung cancer, and the bronchitis. These comorbid conditions may influence mortality and the hospitalization and should be looked for the and should be treated properly. Generally, comorbid should not alter COPD treatment. The COPD treatment should go on and the patient should be motivated. We should also treat the comorbid conditions. If the patient is having a hypertension, then we should treat the patient with the selective beta blockers or the cardioselective beta blockers. Cardiovascular disease such as heart failure, ischemic heart disease, arrhythmias, the many patients with the use of certain drugs, such as theophylline or the SABA, they go into the, or due to the hypoxemia, they go into the atrial fibrillation. So this should be managed, and patient if suddenly becomes sick in your ICU, always go for a X-ray, because sometimes these patients, they go into the pneumothorax and we have to put the intercostal tube drainage should be put, and sometimes a cardiac event can also occur. So you should be aware of these conditions. So as the need arises, these patients should be always treated for the cardiac ailment, other ailment, a good supplement of antioxidants, a good diet, a good antioxidant should be given. As we all know that smoking is also a cause of lung cancer. So these patients should be screened for lung cancer. Bronchitis is also very common in patients of COPD. With the help of the HRCT, we are able to diagnose lot of patients of bronchitis coexisting with the COPD. So always treat for the in patient of bronchitis, you should try for the postal drainage should be tried. Those patients who are having a chronic bronchitis, they will have a obstructive sleep apnea, they will complain of the snoring, they will be having a fatigue, they will be having other comorbid conditions such as diabetes, hypertension, nocturnal desaturation will be there, cardiac arrhythmias will be there. So by using a CPAP, first of all, in patient of COPD, if the patient is having a history of obstructive sleep apnea, you should go for a sleep study. And if he is having an obstructive sleep apnea, a CPAP should be advised to the patient, which will be beneficial. The metabolic syndrome and the diabetes worsen COPD prognosis. Whenever the patient is of COPD comes, he should be evaluated for the GERD, osteoporosis, anemia, polycythemia, anxiety, depression, and they should be also treated accordingly as in, in combination with the COPD treatment. So this is a summary of